Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, propanolol. Propanolol is actually a non-selective beta blocker. It mainly inhibits the T4 to T3 conversion. Apart from this, it has no action on the thyroid pathway. The uses of propylthiouracil is it can be used in the conditions of hyperthyroidism, especially it can be used in the presence of thyroid storm, because in thyroid storm there will be increased sympathetic symptoms are seen. So propanolol can control the sympathetic symptoms developed in thyroid storm. So thus this propanolol is used as an adjunct to control the tachycardia. It can also be used as an adjunct to control the tachycardia or hypertension or atrial fibrillation. For all these propanolol is used. Propanolol is actually it is an initial drug of choice for toxic multinodular goiter, and it is also a drug of choice for thyroid storm with propylthiouracil.
thank you and thank you for watching.